Off we go. I want to welcome everybody to this webinar hosted by the Pennsylvania Association of Community Health Centers on nurse practitioner rotations and how to make them work for better recruitment and retention. My name is Judd Mellinger-Blauck. I'm the director of the Pennsylvania Primary Care Career Center. I know most of you, and it's great to have you with us today. And I'm going to ask the panel to introduce themselves. I'll be the popcorn popper and go around and call on people, and so they can introduce themselves to you. And we'll start off with our faculty today. Dr. Alicia Bischoff, you want to start off?
Sure, thanks, Judd. My name is Alicia Bischoff. I am a pediatric nurse practitioner. I am also a senior lecturer at the University of Pennsylvania School of Nursing. And at Penn, the reason that I came to this meeting today is because I am the central coordinator for all the graduate nursing placements.
Thank you, Dr. Bischoff. And Dr. Metzger, Dr. Lori Metzger from Bloomsburg. And she's been having some technical difficulties, so we'll come back to you, Dr. Metzger, okay? That's all right. Oh, can't turn on the mic. Let me see if, well, Mary Louise Devon, why don't you introduce yourself, and I'll see if I can unmute Dr. Metzger.
Hello, my name is Mary Louise Devon. I'm a family nurse practitioner. I've been practicing for a year and a half. And so I came to this panel today. I was invited as I did my clinicals with a union community care. And so they just wanted my input on how I came about that.
Great. Thank you, Mary Louise. And how about Jesse Miller from Primary Health Network?
Good afternoon. I'm Jessie. I'm the recruitment manager here at the Primary Health Network. We're Pennsylvania's largest community health center. Judd invited me here today. As an organization, we try to support nurse practitioner rotations as much as possible and host quite a few students over the year.
Great. Thanks, Jessie. And finally, Dr. I don't think Kristen's a doctor, but Kristen Ham from Union Community Care. Kristen?
Yes, hi, I'm Union Community Care's newest HR generalist, and I'm here to support Mary Louise and talk about how we've been able to utilize this program in our centers.
Okay, great. I know some folks are having problems calling in, but I did post in the chat a phone number you can call, and so give that a try if need be. So we're going to start off with Dr. Bischoff and Dr. Metzger and see if we can get some input from them. First of all, if you could tell me what the current requirements are for student rotations, both in your program and I think there's national requirements in your certifying boards. So if you would tell us what those requirements are.
Sure, I'd be happy to. So right now, the minimum requirement for student clinical hours in order for them to graduate is 500 clinical hours. So we have 8 or 9 programs at Penn, and the minimal program, the PNP, the pediatric primary care nurse practitioner students are required to have 516 hours in order to graduate. And when you get into the family programs, which incorporate an extra semester to get the PEDS content in there as well, they're up to 750 hours. So most of our students get somewhere between 500 and 750 hours in that range. But you alluded to, changes coming along. So that's the current requirements. However, there is a push right now, and it pretty much looks like it's going to go into effect within probably the next 2 years. Will be that the minimum requirement will be increased from that 500 hours for the program in order for the students to graduate up to 750 hours. So it's a pretty significant increase getting those hours from 500 up to 750, especially for the programs that are on the lower end of that right now.
Quite a change. Dr. Metzger, do you have any, it looks like you're on the phone now and we might be able to hear you. So
I am on the phone.
Oh, that's
I don't know
great.
if you can hear me or not.
We can.
Okay. So I'm responding to the question of current requirements for student rotations regarding clinical hours.
Right. Mm-hmm.
By the way, my name is Dr. Lori Metzger. I'm a nurse practitioner teaching in the graduate program, stepping out of the current chair position for the department. But I am a nurse practitioner for over 20 years, and I'm an adult nurse practitioner. Currently, our students, we have 2 tracks, an FNP and an adult Gero NP, and so their hours are at minimum 800 hours. So there's a different requirement for every course that they're in. They take an assessment course, Diagnosing and Management 1, 2, and then a seminar course that is a culminating course, and over 200 clinical hours required for that course. So that is our current requirement for our nurse practitioner students.
Great, thanks. So to kind of follow up to that, to put it into terms, maybe our community health centers might be able to get their teeth into a little bit more. How many hours a week or a month could a community health center expect to host one nurse practitioner student in a rotation in their program?
Well, at Penn, we generally have the students in clinical 2 days a week. So out of the, or 2 to 3 days a week, I should say, they're in class one day, and then the other 4 days of the week is given for them, so they have some flexibility. Some of them are also working as well, but they're in clinical 2 to 3 days a week.
Okay.
Most of our students are working full time, so it is around their schedule. We also have class 1 day per week. So some students may be able to do 1 or 2 days in 1 week, and the next week may be able to do 2 or 3. However, we do function in 2 semesters, so a fall semester and a spring semester, each semester lasting approximately 14 weeks. We do, however, try to provide some flexibility with students if they need some time to complete hours, especially during COVID. They needed to do that, and so we extended that for them by a couple of weeks, allowing them to get their clinical hours in. But typically it's about a 14-week period that students are expected to complete the clinical hours for that particular course that they're in.
Okay, thank you. And I think that one of the things that highlights is, Dr. Bischoff, are most of your students, are most of them full time?
No, it's probably half and half. Half are full time and half are part time. But regardless, once they hit the clinical component, they all are doing the clinical work full time once they come to that. So it's just that they might get some of their didactic courses out of the way before they hit the clinical component. But once they hit that, it's 1 year from the time they start their clinical till the time they graduate.
Okay, that's interesting. So I think that one of the things that points out is that, not all the NP programs, from what I can tell, not all the NP programs they're not all the same. They're run differently. They're set up. I mean, they all have the same requirements eventually, but they're set up differently. And I think that maybe that some of our health centers need to keep that in mind as they're working with different schools. That's going to be maybe it's a different situation. So that the HR directors, Kristen and Jesse, can you tell us how you handle? I know there's a lot of nurse practitioner rotation requests come in. How do you guys handle that? How do you get it? How do you keep that organized, or is it a real challenge and you're still working at it?
Well, I'm happy to answer. I am still learning. I know that what we do is we try to find students that have a passion for our mission and vision, so that we're taking on students that are in line with what our philosophies are. So it's different if someone's right off the bat knows that they want to do something different with their career, then I'm usually passing on that person.
Great. Jesse?
We're very, very similarly. We take requests, and there's a point we do stop for the summer and the spring and the fall semesters. We book ahead pretty quickly. But really, like Kristen said, we're looking for people that align with our mission and vision and what we're doing in the communities. But we also prioritize locations. So if the student has ties to an area, where one of our sites is located, we would be more apt to provide them with an experience with hopes of them staying in the area and providing care to the community. And we do also do some prioritizing of the schools that we've had, long-term relationships with. And also because a lot of times our providers are more willing to take students from the schools that they went to.
From their alma mater. Huh, that's true.
Sometimes only their alma mater.
Only.
Mm-hmm.
So secret for Bloomsburg and Penn is to get more of their people into our health centers and then and to get them hired. But so do you have agreements? Do either of your health centers have agreements with certain schools, written agreements?
Absolutely. We have agreements with several schools. Yeah.
Okay. Jesse, do you have some written agreements? Yeah.
Yep.
Okay. And do you either of you allow do your preceptees have to come through your health center, come through you, or can say one of your NPs, say Mary Louise wants to take on a preceptee, somebody on rotation, you just go ahead and do it? I mean, how does that work?
We do allow that if there's a personal relationship. You just never know. There's always extenuating circumstances. But yes, if a provider comes to us and has a candidate that they want to precept, that we do let them do that.
Okay. So I'm sorry.
But everything has to come through. We do the same thing, but everything has to come through HR.
Okay.
Well, yes, I should have clarified that, but yes.
Okay. All right. So if somebody wants to do that, they can do it, but they need to clear it with you guys.
Yeah.
I'm sure the chief medical officer, somebody has a little say in that too. When you're looking at productivity. So I'm going to throw this open to everybody on the panel and anybody else who wants to take a shot at it too. What are some of the problems you see with the current system? What are some issues that have arisen and why is it so difficult to get placements?
I find one of the things is there used to be a lot of mom and pop privately owned practices. So you could simply go to the one practice and say, can you precept our student? And the buck stopped with that one person making the decision. But now so many of those smaller practices have been bought up by the larger health systems, and the larger health systems, it's multiple layers to get the permissions. And not only that, but they have agreements with certain schools or certain organizations that they will only precept those students. So in our area, you have the big health systems, you have the Penn system, you have Jefferson system, and then, those health systems have bought up multiple other practices so that now if you're a Jeff student, you pretty much can get into the Jeff system. And if you're a Penn student, you can get into a Penn system, but there's not a lot of letting the students go between different health systems.
Gotcha. Yeah. And what else? Dr. Metzger, what are some of the issues you're seeing in the current system?
Well, because I'm not in the, it sounds like, Dr. Bischoff, you are in the Philadelphia area, right?
Correct.
Yeah. I'm in a more rural location in Bloomsburg University. So our bottom line is we just don't have enough preceptors for the number of students. So when you have 60 or 80 students matriculating at any time that need some kind of clinical area, but there's just not enough because all the other, schools have nurse practitioner students that are competing for those sites. I agree with you with multiple layers to get through, even though you might have a contract with them. But, in any given endocrinology, there might be 2 nurse practitioners. Well, I can only get 2 students in then. I go to another clinic, family practice, there might be 3 or 4, and I can only get 3 or 4 in. So it's just not enough clinical sites for the number of students. That's what we experience because we're competing with other nurse practitioner programs, but PA programs, those kinds of things as well.
And in addition to that as well, too, years ago, there weren't all these online programs. So students had clinical in the area where their school was. But now with online programs, you can have a student who's, their school could be several states away, but the student resides in your area. So they're now added to the pool of students who are trying to compete for the same sites in that area.
Absolutely agree.
Yeah, that makes it difficult. You notice I didn't get a representative from Frontier Nursing School to come on here or any of the other ones. I think I would have lost two panelists if I would let that happen. So, yeah.
The other thing I wanted to just, I'm
please.
sorry. The other thing I want to say is also not only are you competing with the PAs and the NPs, but you're also competing with med students. You know, I graduated a year and a half ago, and when I was looking for clinicals, it was tough. It was really, really tough. And the one thing I worked for Penn Medicine, and I could not get a clinical site with them because every site I tried to get into was, oh, it's reserved for the residents. It's reserved for the medical students from Penn. It's reserved, you know, so there was different ones. Even if, you know, like Kristen said or Jesse said, you could have relationships with other people and but you couldn't go in there because it was reserved for a medical student. So you can always run into that problem as well.
That's interesting because, well, yeah, and there's only so much capacity, and like our faculty members were saying earlier, it's really, if you're UPMC, you get first shot, so what are the how in the health centers, particularly our two panelists, how have you managed to I think we might have lost. Did we lose Kristen? I'm not sure. Oh no, there's Kristen. Sorry, you got moved around on the screen, and I lost track of you. How are you guys? What are some things you're doing in your health centers to try to build in some capacity to do these rotations? Are there any strategies, or do you still struggle with that on an ongoing basis?
I mean, I think we're still struggling with that on an ongoing basis. Even our own health system we just did the numbers, and I think they said they're only 20% of our students are getting their clinical rotations through our own health center. And when certainly they're willing and they're trying to help us, but the health centers are up against obstacles as well too, because there's so much turnover right now within the health centers that there's a lot of resources going towards training new employees before they can even think about having students. So they want our students, but they need to get their own staff in line first before they can take on more responsibility.
Mm-hmm. Mm-hmm. So, Kristen or Jesse, I mean, are you finding any solutions out in the field? We're just trying to get more people on your staff to be willing to do this.
Yeah.
Do you offer any kind of incentive to do this?
We don't.
Yeah.
We don't either.
Yeah, I'm finding that we've asked about that a little bit too, and it's really pretty rare to offer that. And I'm not sure if that would, but they have a program in Ohio that I've talked to some of you about, where they offer a stipend to people who do host rotations to take that on. So it's something we've looked into. Mary Louise, why don't you tell us a little bit about your experience and why it was a good experience for you at Union Community Care and how you ended up there?
Okay. So like I said, I just graduated a year and a half ago, well, 2 years ago, but started at Union a year and a half ago. Prior to that, I worked 20 years in obstetrics and for Lancaster General Health, thought I was going to be a Penn Medicine lifer. However, when it came time for clinicals, they were not able to help me get any clinicals. And so I had to really go out and find my own and kind of go backwards about getting clinicals. And so, went to my family doctor and said, hey, can I do clinicals with you? That was one rotation. Second rotation came after COVID, and I hit every provider that went through our labor and delivery department. And we had residents, so I knew a lot were family medicine. And I hit everyone up and I said, somebody's got to know somebody. Can you take me on? And One of the nurses I used to work with became a midwife, and her husband used to work work at Union Community Care when it was Lancaster Health Center. And he said, I'll get you in touch with an FNP. So he did. And I just harassed him until she answered me. And I got in with her. COVID hit, and it, really harassed them again. Like, can I go? Can I go? Got my clinicals in and loved it. I never really thought I was a community health center. Like I said, I thought I was going to be with LGH for life. I thought I was going to be in this, not private, but, kind of like the private family practice, and just never really thought I was going to be in this federally qualified health center. And once I started there, I realized that I also have my MSN in nursing education. I teach at Harrisburg Area Community College on my days off. And so education has always been a passion of mine. And I felt that I could use my education degree in teaching these patients as well. And there was just so much that I could give them, but they were also willing to learn as well. And I fell in love. So I did my first rotation with this woman, Linda, and my second rotation fell through because of COVID. She said, or my third rotation, she said she'd keep me on. Thank God. And so I stayed on, and everything was smooth sailing. Everything clicked. It was as if I was working there and not doing clinicals. And like everyone was saying, their students work full time. Like Dr. Metzger was saying, they work full time. I worked full time. I taught at HAC 1 day a week, and I was doing clinicals 3 days a week. And a position came available before I even graduated. I applied. I got offered the job before I even graduated, and I have never looked back. It has been the best experience. My patients give me hugs when they come see me. I love taking care of the family. The patients come with the kids have something, I can see them. It's been wonderful. I'm so glad that I walked away from LGH and never looked back. I don't think I would have been happy there, and not to say anything about them, but this happened for a reason, and it just has been the best experience. And I have an NP student with me right now. And she was one of my my RN students that asked if she could do clinicals with me, and I took her on. And as Kristen and Jesse were saying, you want somebody that kind of has your values. And as we're progressing through clinicals, I realized that she's not somebody that's an FQHC provider, but we're almost done clinicals, but you kind of know that person that just has the passion for taking care of people that are underprivileged. And it's been a blessing. It just truly has been.
Well, Mary, I think we need to take you along to the Pennsylvania Coalition Nurse Practitioners meeting when we're recruiting there, and just let you talk. That was awesome. That made me feel
one
so
thing
Thank you.
I think when Kristen and Jesse were saying that they just don't have people that want to precept, I know it takes a lot of time. It is exhausting at the end of the day, especially when somebody's with you 2 or 3 days a week and you just want to have 1 day by yourself. But if you don't get one, I'm doing it because I know what it was like to not have a preceptor and that feeling. But if we don't precept these people, who's going to be there to fill the positions when they're available? So somebody has to be there. And so somebody's got to do it. So that's how I look at it. And I do love teaching. So
That's fantastic. Thank you. Well, I don't know how I follow that up. That was a tough one. That's great. Thank you so much. I mean, and that raises a question. How do we you know, and this is open to everybody. I mean, let's just throwing this out there. How do we get more people like Mary Louise who are willing to do this with keeping in mind that there is it's difficult recruiting people, and this is one way to get them in the door. So how do we do that?
I think one important thing that Mary Louise said was that, you know, she thought she was going to be LGH, be a lifer there. And, you know, looking at the FQHCs really wasn't on your radar. So, you know, when you're hearing some of the other panelists say that, you know, you want a student who's a fit and that wants to remain within your organization, sometimes they don't know that either until they get into the door and then see, you know, what it's actually like. If you never tried it, if you've never been there, you might have like a preconceived notion that's different from what it really is like.
Great point. There's got to be you know, and I'm saying this. I've opened this up to other folks who have called in, who have logged in. I mean, is anybody exploring ways to incentivize your nurse practitioners, or to just you know, without incentivizing them with dollars or PTO, just with the idea of the mission of the organization and trying to get more people to participate? Is that happening anywhere?
I think that's the goal of the schools, or what can we get back to the preceptors? And, you know, there's always the notion out there is, do preceptors want to get paid? And I really don't. I mean, I think money is always important, but I don't think that is necessarily the end goal. I think it's what else can we give preceptors? For instance, continuing education. So we offer a full day conference every year for all of our preceptors. That's free to them. And we offer CEUs for them for pharmacology hours, as well as just their general CEUs that they need. We offer them access to our library, which can be very valuable, because through that library they can get access to up-to-date, as well as all the healthcare journals. So a lot of our preceptors want to precept because they really want that access to our library as well. So I think there's other perks out there that we can offer preceptors outside of monetary. And then going back to the money as well, you know, we did come off the G&E grant, which I guess maybe 4 years now we've been through that grant, where preceptors were actually getting some kind of payment for precepting. And I don't think it made it any better. In fact, I think it made it a little bit worse, because it was who's actually getting that money, because sometimes the preceptors got the money, but oftentimes it was the organization, higher ups in the organization that were getting the money, and not the individual preceptors for doing the work. So I don't think that money is always the answer, but I think saying, you know, what actually do our preceptors want, and how can we fulfill those needs for them?
Judd, if I can offer a couple comments.
Sure.
This is Joe Hollander from Scranton Primary Healthcare. I'm going to disagree with Alicia. First of all, our nurse practitioners get allowances and days to do continuing ed trainings. So I don't think you making it available at no charge is going to be of any type of inducement. Number two, all of our nurse practitioners have contracts signed with us where they're needed to get paid directly, because of the fact that they are full-time employees of Scranton Primary. We have PA programs now starting to offer stipends, and I think it really comes down to the amount of the stipend, because we've had 2 programs that have offered $500, and when you look at the amount of work that's involved, because our nurse practitioners have numbers that they're expected to meet, encounters, et cetera. And when you have a student and you're precepting, it affects that. And it does add to the burden in the workday, especially if it's done properly. Because when we act as preceptors, typically what we do is we'll, after the first couple visits that the student has partnered with the provider, the student will go in alone and then come out and then make their own notes and remarks, and then the provider goes in and then they discuss either that they agreed, they didn't agree, what was missed, etc., what should have been done. So it becomes a lengthy process. So again, $500 for a student, if that's what you had in mind or that's what you were paying, is not going to make a difference and is not going to entice someone. Especially now coming out after COVID, every one of our providers worked the entire time. We didn't close at all. We didn't go to a work from home model or anything else. The last thing that they're looking for is extra work. Yes, Judd, they'll respond partially to the mission and partially to the argument that someone was there for them. But again, I truly believe there are very, very, very few people who aren't motivated by the dollar. Students that are coming out of school, regardless of the level, whether it's doctors, whether it's dentists, nurses, etc., a lot of them have debt that they're paying back. They're looking first and foremost salary, and then is it going to be a fit? And I think we have to recognize that and not discount the fact and just say that there are other things that will entice them. We have, I think at last count, 11 NPs here, so we have a great deal of experience with them and know what they're looking for in a mix of some fairly new and some seasoned.
Okay. Well, that's interesting. It all depends, I think, on where on the person, and I'm not sure. Mary Louise is willing to do the precepting and not get paid. So it does vary from place to place, I guess. So the issue is that we have job openings. We have a lot of job openings for NPs, and we have a difficult time recruiting them into that. And this is a proven technique for recruiting. I mean, you got great examples sitting right in front of you. So I'm not sure where you go from here. I just anybody else have anything they want to add for on ways to build this program and make it more feasible?
I'll just contribute for Bloomsburg University that one of the things that we try to embrace is becoming a clinical partner. And we really do emphasize like that tagline of being a clinical partner. So whether it would be with Geisinger Medical Center, UPMC, or wherever, Evangelical Community Hospital, we try to partner with them so that it is a situation where they're willing to take our students because we're willing to do recruitment fairs and those kinds of things so that our nursing students go to those organizations in order to apply for positions. But we also exchange things, as Alicia was indicating, whether there's research days or things like that. We try to do events collaboratively so that we are in this situation together. It's just not the hospital that supplies the clinical site and the educational institution that provides the student, but rather it is a partnership, and we work together in order to keep a healthy healthcare environment for practice, for learning, and for our patients collectively. So we do try to embrace that term of being a clinical partner with our institutions.
I'm going to go off just a little bit off the track here, a little bit as far as clinical rotations. Another way to build skills in nurse practitioners becoming much more popular are residencies, postgraduate residencies. Dr. Metzger, Dr. Bischoff, are you pushing that at all? Are you encouraging that? Do you have residencies at your programs? Do you think, and there has been some emphasis on on community health centers starting residency programs. CHC Inc. out of Connecticut is kind of a leader on that. And is that one way that community health centers could get more face time and potentially recruit nurse practitioners.
We currently do not have we do not have a lot of students, if any, that I'm aware of right now doing postgraduate residencies. However, we are open for students to try different areas, and we do encourage that in our students to try different settings, different facilities. It is about a match of philosophy and mission and values in who you're practicing with. So I appreciate Mary Louise's comments very much there. And so we do encourage them to look at different areas in order to gain their clinical hours, but currently we're not using a postgraduate residency.
I agree. We're not, similarly, we're not using any kind of residencies afterwards either. Sometimes the individual students will pursue them, but for the majority of our students do not.
It's a challenge after going through all that training and incurring all that debt, and then to go into a residency that the ones I'm thinking of pay at about maybe 2/3, maybe a half of what they would make working full time. So very good. So I think one of the things you're hearing, and kind of wrap up here a little bit, is this is a difficult process. I think you see that in the attendance that we have today, which is not stellar. And that this is difficult, and something we continue to work at as an organization to try to encourage this. HRSA, it's very big on this. They don't have any solutions, by the way, nor are they offering any money for it to do it, but they really want health centers to be more involved in this. But again, like I said, they're not. They're just encouraging it. There's no funding. But we'll continue to work with this as an organization. Anybody else have anything to add to the conversation today?
Judd, I was just wondering if the health centers have NPs that are interested in precepting. I think it would be a good idea for them to reach out to some of the schools that they have relationships with or contracts with or agreements, and just say, hey, if you have students this semester that are looking for a rotation in this area, we have some NPs that are willing to precept, especially for some of the schools that do sorry, I just lost my computer here. For some of the schools that do set up clinical sites for students. I don't know if Penn or Bloomsburg do. When I graduated from Wilkes, and the year after I graduated, Wilkes started setting up clinical sites for all of their students in the NP program. But I think if you have people available, instead of just letting them wait for somebody to walk in and say, I need a clinical site, you could always reach out to the schools and grab up some students.
I agree. So at Penn, we do find clinical spots for all of the students. And, for many of the organizations, we have a relationship, and we we'll get so many spots within that organization each year, and we just simply send them over the names. But for many of the other ones, we have to go out to the organizations or to the individual practices every year. And that does rely on the coordinator. So that's pretty much my responsibility to find placements for all of our graduate students.
Judd, this is Kate. I'll throw in there from like the non-panelist side of this, that I mean, I know that it's kind of like a playing devil's advocate when I say this, but I essentially agree with almost every single thing that has been said about this on both the challenges side as well as the incredibly worthwhile side. Like, some of our best providers were students with us in their last semester. I know that it's always going to be a challenge, but like, I'm literally here not because we don't do this yet, but because I know that we could do it better. And it has huge implications, even just for me and my HR role as a recruitment pipeline. It's just so worthwhile. Like, is there truly a better interview process than, you know, a 2-month, 3-month rotation with someone where one of our own providers can then vouch for them. That kind of quality time with someone in that pre-employment phase is just invaluable for so many reasons. I completely agree that this concept, like, no offense to people who are in online programs, some of our providers have done the online programs, but that has infinitely complicated in terms of how many spots we have. Like, we have 3 schools that we have really good relationships with that are in-person schools. And then all of a sudden, like, these online programs started creeping in. And I'm at the point where I actually just blanket will say no to creating more academic affiliations right now, because I don't have enough preceptors as it is, and I'm someone who feels tremendously guilty saying no. And it's really hard turning someone down. Our providers do not get incentivized. I actually only have one provider who is just like a blanket no, and actually she's our most experienced nurse practitioner. She actually was in academia for a while, and I think she just feels like she put her time in. She's done with the teaching thing. She just wants to do patient care. But other than that, most of our NPs are younger in their careers, and it is still fresh in their minds what that, you know, panicked, frantic search for a spot was. And so they are enthusiastic about taking students on with them. It's not something that we have needed to incentivize. But that being said, sort of, I guess, our like maybe incentive to them is being really, really encouraging of a healthy balance, where we say to them, like, you are never obligated to take a student. We highly, highly encourage it. We're trying all the time to become more and more of a fully fledged clinical campus, where we do time with LPNs from the local CTC and the vocational school that's nearby. We're even trying to get some behavioral health students going on. Like, we want to cross the disciplines, but none of our every one of our providers can guilt-free say no at any point. And sometimes if you just give them a semester off, that is so appreciated. And then they're ready to jump back into it again. So, I mean, I don't think we're ever going to be at the point where we incentivize it. You know, we are a much smaller, so, like, you know, I mean, I know Jesse is one of the biggest health centers. We're probably one of the smallest, but it's still, you know, I'm a department of 1, and it is still amazing, regardless of how many employees you have, when you are a department of 1, how much time it can still take. And I want to do better with our clinical rotations. I do just have like 2 questions, not about the 30,000 foot view. This is probably more of like the 3 foot off the ground view, but if it's okay to ask them,
Please.
I'm wondering if you guys, if anyone here has ever seen like a very brief interview, so to speak, process with students before they're taken on. I've had a couple preceptors actually say to me, you know, like, if I had met that person in advance, I might not have taken them. Just like some professionalism kind of things. Not that they didn't finish a rotation out, but, you know, that it was not the best experience and they feel like maybe it could have been avoided. And then I'm also wondering what your onboarding looks like, because you know, I have my own little process for it, and a lot of that is just getting information from the schools. Sometimes the students will be able to provide it to me, you know, depending on how engaged or what kind of capacity that clinical placement specialist has. But I'm wondering on the HR side, what your onboarding into the organization for students looks like.
I can answer that. Okay, it's Jessie. So to answer your question, we do have sometimes providers that say, yes, I want to interview them. And typically we just set up a very brief Zoom. We'll set up a Zoom for the provider and the student to just touch base. And that's really a select few of our providers. A lot of them are comfortable with just getting the resume, reviewing the resume and saying, you know, yes or no, I'm willing to take that student. And most of the time they are willing. Some of our providers just like to have the students a little bit further along, maybe not for some of their initial rotations. And then as far as onboarding goes, I do the same thing you do. I work typically hand in hand with the coordinator, getting clearances, paperwork, COVID vaccine card. And then we have them just complete a small orientation packet where they sign off on the policies that would apply to them as a student. And then our preceptors are also provided with a small packet that just kind of explains what's expected of them from our side of the organization, asking the patient's consent before they have a student in the room with them. The student can't use the EMR system, but they can observe you utilizing it, just things like that. So there's not really anything very formal. I'd like to formalize the process a little bit more and make it a little bit in depth. It's just hard to do that when some students are with us for a whole year and some are with us for a few weeks. So that's what we're doing right now.
Would that sounds fantastic, actually, to me. Would you be willing to share that packet?
Yeah. Yep. Of course.
Okay. Thank you so much. I will shoot you. I think I have your email. I'll shoot you an email later.
Perfect.
Great. Thanks, Jesse. And great question, Kate. Did you have another question?
No, it was she answered both of them. It was about whether or not there is a
Right.
an interview beforehand. Jesse,
Right.
just a really quick follow-up to that. Is that literally just between the student and the preceptor, or do you hop on that as well?
No, it's just the student and the preceptor. Like I said, it's only a handful. We have I think 2 or 3 physicians that like to do that otherwise. And it also depends on the length of it. If they're going to have them for a couple weeks, maybe not. If they're taking them on for a lot longer, then they want to do the interview. But normally it's just finding out if they are going to be a good match for that clinic.
Okay, perfect. Thank you.
Great. Thanks, Kate. Any other questions before we call this to a close? Okay, thanks everybody. I think, I do have one last thing. Hang on a second. I'm going to put a link in the chat, and everybody, all my members at least, please fill out this very brief SurveyMonkey form, okay? Because HRSA, this is one of our requirements to do this webinar, and I need to give results to HRSA and tell them. So you don't need to be nice to me or anything on there. Just you can be honest, but I do need to give them results. So so if you could take a second, open that up, and take a second after we're done here to complete that survey. I greatly appreciate it. And I want to say thank you to the panelists for giving us their time today. Those of you who were on, thank you so much for taking the time to listen in and ask questions. We will be saving this recording for future use. And nothing else. Everybody have a great holiday weekend, and enjoy any time off that you're able to get. So thank you so much.